it's something that Kenyans have started falling in love with, making sure that they get to enhance how they look. And most of them choose a path that is maybe in the 90s or early 2000s would not be a path that Kenyans would prefer, especially when it comes to cosmetology, like just trying to enhance how you look, but by going under the blade, meaning that some people have decided to go under the blade or under surgery to make sure that they enhance some parts that they're not maybe really happy about, or maybe they're just trying to get quick results.
And this story was pretty much everywhere on social media and mainstream media a few days ago after a woman's death after a liposuction procedure at a clinic in Nairobi. That is Lucy Wambui, 47, who passed on after a liposuction procedure at a clinic in Nairobi. Of course, her family called for justice, and we also saw former Nairobi Governor Mike Sonko at the facility calling for its closure and so on. But now there's a crackdown that's happening. The Public Health and Professional Standards PS, that is Mary Muthoni, announced that unethical facilities are putting lives of the Kenyans at risk. And this comes after the death of Lucy Wambui. And of course, in a letter seen by The Nation, the PS instructed that the Kenya Health Professional Oversight Authority be there to coordinate a thorough assessment of facilities and submit a comprehensive report within 30 days. Of course, this went to its CEO, Dr. Jackson Kioko.
And of course, the Minister of Health expressed concerns about malpractice and non-compliance in some cosmetic surgery facilities. We're looking at KMPDC, that is Kenya Medical Practitioners. Investigations found serious malpractices at Omnicare Medical, where Lucy Wambui's condition was not actually taken seriously. And for those who are asking themselves what liposuction is a medical procedure whereby they insert a cannula. A cannula is a small tube which sucks fluids off the body. And of course, for Wambui's case, she experienced such an abdominal pain and difficulty in breathing, which later on caused her death. The chief government pathologist, Johansen Odor, said that Wambui died from acute pneumonia due to untreated bacterial infections.
Now, of course, this does bring into question a lot of things. One being, how well do we regulate our healthcare facilities overall? I think that's a big question. And I've even zeroing in on those that do perform cosmetic procedures. And of course, how well regulated are they? Are the people who are there licensed to do what they're doing? And then what recourse, of course, is there in the event that things do go wrong, as they sometimes do, like in this case? Of course, there was a lot going on social media, people saying that this was not the first such case, that other people have died in the hands of clinics like this. Of course, those are contradictory statements that were refuted by the clinic itself, but we do, of course, wish justice for the family of Lucy Wambui.
And of course, there's the hush tones that you'd hear a word on the street that one person might have had complications soon after maybe surgical procedures that are cosmetic, and not most of them are actually reported. I think with the family of Ms. Wambui, they were actually serious about making sure that this case goes on to the next level. So we hope that we can get a perfect report on what's happening on ground after the investigation. They've said it's 30-day investigation, so we hope we're going to get a report. And also just take care of ourselves. Also, my advice, I'm not saying it has anything to do with the case in particular, but I'm just like, you see how you're created and how you are. If you want to make adjustments, you can do them naturally. Because I feel like going the surgical way, human error might actually be involved.
I'll say what we do need is proper regulation of the industry. I don't think people will stop cosmetic procedures, and it's within their purview to do so. But unless they're properly regulated, then we can't guarantee people's safety.